Hi, my name's David, and today I'm going to be talking about the app Micromedex. What is it? It's a reference guide for various types of medical information, such as common and uncommon drugs, drug interactions, IV compatibility, pediatric dosings, neonatal drugs. It's a web-based or app-based software. Hospitals can buy a few different types of the suite to be made available for anyone working in their hospital. It is integrated into over 2,000 hospital electronic medical records currently. It can be accessed very easily to view everything from information about a specific drug, what it does, its adverse reactions, contraindications, what type of IV fluids and medications can be run together, and specific pediatric dosing information. The app is available to the general public by either logging in with your hospital-supplied password or purchasing it for $2.99 per year. Since this presentation is supposed to be about something accessible on your mobile device, I'll focus more on the apps available from this company. Who uses it? Over 5,000 healthcare organizations worldwide. It is integrated into over 2,000 electronic medical record systems in the United States. It's used by 100% of U.S. poison control centers. It's used by the majority of U.S. accredited schools of pharmacy. Basically, anyone who wants to buy the app can use it. One of the apps available is all about drug information. You type in a drug name and it will give you all sorts of information about it. It will tell you what the drug is used to treat, other trade or generic names for that drug. It will tell you if the drug has interactions with other drugs and the names of those drugs and the specific reaction. If that drug has any black box warnings associated with it, the app will tell you what they are. It will list any adverse effects that a patient might have to the medication and explain what they are and how to identify if they are in fact having an adverse reaction to the drug. IV compatibility. A helpful way that this app can be used is to determine what type of fluids can run with a certain IV medication. Let's say your patient is currently receiving IV fluids with D5 and lactated ringers and needs to have a bag of mag sulfate run as well, and you only have one IV site. Well, you could stick the patient again and get a second IV site, or you could quickly open Micromedex and plug in both fluids and see if they are compatible to run together. Much easier than starting a new IV, especially if the patient is a hard stick. This can be very helpful since the electronic medication administration record will not tell you these types of things. The pediatric and neonatal versions of Micromedex provide specific drug information to the neonatal and pediatric patients. The neonatal version is for full-term babies from birth to 28 days and preterm babies up to 44 weeks post-menstrual age. The pediatric version is from patients 29 days old until 18 years old. It contains basically the same information as the adult version, but contains information specific to neonates and peds, like medications based on weight. It also contains a built-in enteral nutrition section to give you information on different types of infant formulas. We all learn weight-based dosing for pediatrics in nursing school, but then most of us never use it again unless we work in a pediatric unit. This app could be a very useful tool if you happen to have a pediatric patient on an adult floor, or even for the pediatric nurse who needs to check a medication which they are not familiar with. Legal and ethical. Micromedex as a whole is a very reliable site and app used for patient care. It has been the industry standard for over 40 years and follows all the requirements made by the Joint Commission. All of the information provided by this site is based on evidence-based resources. As far as an ethical standpoint, you never actually input any patient information into the site or the app, so the patient's information is protected 100%. In conclusion, all of these apps made by Micromedex are a very fast and effective way to get information about different drug information, IV compatibility, and other very useful information. An important thing that we as nurses do is teach our patients. This app is a great tool to use to teach the patient about important drug information, such as what to look for in case of an adverse reaction. The top priority when caring for our patients is their safety. This app allows us to improve their safety by giving us an excellent resource to check the meds and fluids which they are receiving in order to prevent any adverse reactions. Thank you.